Ha.
Online. Good morning. Good morning, everyone. Khaled Chushan, can you hear us?
Yes, good morning.
How are you?
Yeah, good. I'm good. Thank you very much. Thank you for the invitation.
Thank you very much for having time for us.
Thank you. Thank you again.
Sorry for being a bit late. Someone is okay. So first of all, thanks a lot for with us today is our good friend and the chairman of the Armenian Forward Together Forum, Yelena Bisharyan. Thanks a lot for allowing us to organize the symposium within the Armenians Forward Together forum. It's the first time we are having this symposium, and thanks a lot for the attendees, for the registered people. This year it's not very large, but hopefully next year we'll multiply. And also thank you very much for our speakers for having time to be with us. Today's our symposium is dedicated to cancer and crisis, specifically cancer care in conflict-affected setting. It's a very sensitive topic, and hopefully we'll be able to explore some of the challenges, and we'll try to find some kind of solutions how we can handle these problems. So it's the title of our symposium today is the accessibility of cancer care in a conflict-affected setting. And we'll go ahead right away with the first presentation, which is by Dr. Yeva Margaryan, who is the co-chairman for today's symposium. And Yeva is the CEO of the Institute of Cancer and Crisis. She has an MD from YSMU and the Yerevan State Medical University, and a public health degree from the American University in Armenia. Yeva has been working with us for several years, coordinating our solid tumors working group, and then together we co-founded the Institute of Cancer and Crisis, and she's successfully handling the work of this important institute. Yeva will present the Institute of Cancer and Crisis, the work we have been doing, and what future projects we do have. Yeva, please go ahead. Thank you.
Thanks a lot, Dr. Tamamyan, for this nice introduction. And thanks everyone who attended today, and let's start. So just some background information about the Institute of Cancer and Crisis. Institute of Cancer and Crisis is a non-profit independent organization that was founded in 2021 in Yerevan, Armenia, as Dr. Tamamyan said, by myself and him. And our mission is to raise awareness about the impact of different types of crises on cancer prevention, cancer diagnosis, and cancer care, and also to mitigate that impact via dedicated research and advocacy. So first of all, I'm very proud to have these people in our board of directors, and I'm pleased to introduce all of them. So Dr. Gevorg is a co-founder and the president of the board of directors. He's chairman of the Pediatric Hematology and Oncology department at the Yerevan State Medical University. He's the head of the Pediatric Cancer and Blood Disorder Center of Armenia, and he's a CEO of the newly established Immuno-Oncology Research Institute. Dr. Wendy Yaret, she's a director of the European Cancer Leagues. Dr. Ralph de Clemente, he's chair of the Social and Behavior Sciences at the New York University, and also a dean of the Health Innovation Institute. Dr. Gregory Kalamkerian, he's an oncologist and a professor of internal medicine at the University of Michigan. Dr. Stella Arakelian, she's a lecturer at the Donkey University. Dr. Emma Ghazarian, she's a policy officer at the WHO Armenia office. Dr. Hobanes Bartevanyan, he's head of the imaging diagnosis department at the Armenian American Health Center. Dr. Christos Tsagaris, he's an resident at the Zurich University, medical resident at the Zurich University, and Dr. Gemma Arakelian. She's an oncologist at the Hematology Center of Armenia. She's a PhD student at City University of Hong Kong, and she's also a lecturer at the Oncology department at the Yerevan State Medical University. Alisa Kamaran, she's now here with us. She's a clinical psychologist. She's the head of the psychosocial services at the Pediatric Cancer and Blood Disorder Center of Armenia. Hera Artinyan, she's a head nurse at the American University of Beirut, and Eleanor Vartmian, she's the president of European Health Parliament. And let's just discuss what we have done during this year, and what are we working on now, and what are we planning to do. So during this year, we have prepared a commentary entitled Cancer and Armed Conflict Crossing Realities. Alisa Kamalian, who wrote the story based on a real story about a patient from Nagorno-Karabakh who had a terminal cancer and needed a palliative care, and who was in Nagorno-Karabakh during 2020 Nagorno-Karabakh war, and he struggled to get the needed painkillers, but he also had that emotional stress and that pain of understanding what's going on in Nagorno-Karabakh and hearing the sounds of bombs next to his house. So this is a sad story, but it has a big message in it, and we also added some other examples from other countries affected by conflict. And we made a beautiful paper, which was later published, but we will talk about it in a couple of slides. So also we drafted a systematic review, actually like 28 pages long systematic review that comprehensively discussed the impact of different types of crises, including nuclear accidents, COVID-19, armed conflict, natural disasters, how they affect the cancer care. And actually, by discussing effect of each type of crisis, we can clearly see that no matter what type of crisis is it, no matter which country it affects, it's a low and middle income country or it's a high income country, these different types of crisis has almost similar effect on cancer prevention, diagnosis and care. They disrupt the normal provision of cancer care, and there are still no practical manuals, no protocols on handling these situations in times of crisis. Whereas there are lots of protocols on how to cope with how to cope with emergency situations and how to treat people with some emergency diseases, and nothing for NCDs, especially cancer. And then we also conducted to our knowledge, the first cross-sectional study exploring the impact of COVID-19 and armed conflict on cancer care in Armenia. Scientific data, scientific evidence on the impact of crisis on cancer care and make it more accessible. We also have a website where we post about our project and the publications. We also introduced the Institute of Cancer and Crisis in different workshops and international conferences. One of them was the introduction of Institute of Cancer and Crisis in 8th Bukovian International Medical and Pharmaceutical Congress of Students and Young Scientists. We promote the Institute of Cancer and Crisis among stakeholders, among cancer researchers and professionals from other disciplines that are interested in this topic. And we also have another project that is called Expert Interviews, where we interview experts in the field that have some experience, some personal experience regarding the impact of crisis on cancer prevention, diagnosis or care for cancer research. And we have a YouTube channel where we post these videos and share those via social media. And currently, I'm sorry. Yes, as I said before, our research projects are also being published. So the commentary prepared by our team and authored by Alisa Kamalyan was published in Journal of Clinical Oncology in Art of Oncology. And I'm proud to say that Journal of Clinical Oncology is has the highest impact among cancer journals and in the world. And So this commentary was published there, and we're proud about it. So the next publication is actually the abstract that was accepted for the online publication at the ASCO annual meeting 2022 was the abstract on the cross-sectional study that I was talking about before. So I would like to give some more details about this study. So it was conducted, as I said before, in 3 major oncology units in Armenia, in Hematology Center of Armenia that has all pediatric cancer patients and hematology and patients with hematologic malignancies, and also we have a department of solid tumors. Also a National Center of Oncology after Margaryan, that is the largest cancer institution, the largest cancer health facility, oncological health facility in Armenia, and the oncology unit of the Margaryan Institute of Surgery. Overall, we had 96 participants, and the analysis of this data, we found that COVID-19 and armed conflict mainly affected the surgery services. They affected also the blood transfusion services. Also, there were cases that oncology staff couldn't work because of being diagnosed with COVID-19, and even around 10 people from oncology staff have died because of COVID-19. So we are currently working on the full manuscript of the study. And yes, I would like to also say that this study was also co-authored by people that are here present now today, and Liana Hambartumyan, hematologist from the Hematology Center, after Professor Yolian, and Vigrana Hatagan, who's an MD, graduate from the Yerevan State Medical University, and their role in the data collection, in the analysis, and in preparation of the manuscript was very significant. So ongoing projects, as I said before, we need to finalize the manuscript on the impact of COVID-19 and armed conflict on cancer care in Armenia, and also to finalize the systematic review that comprehensively analyzes and describes the impact of different types of crises on cancer care. And we also started an IRB, but it's a very important project that, to our knowledge, is the first in Armenia that will investigate, that will study the quality of life of people living with cancer and other comorbidities in Armenia. A very important topic, a very important aspect that is not well evaluated and well investigated in Armenia. And this will be a pilot project conducted in Hematology Center of Armenia. And later on, we plan to apply for a bigger grant that will include also other cancer units in Armenia and make some nationwide study on this. Since, as I said before, there is no data at all about the quality of life of these patients. So again, we will continue to conduct our expert interviews. We will continue to contacting professionals and stakeholders in the field, trying to have some joint projects or studies. We will also continue to raise awareness via social media accounts, the workshops and conferences. In future, we also plan to have to organize an international conference in Armenia and host people from other countries. So upcoming projects, we plan to conduct 2 important studies that also have not been conducted in Armenia that we lack an information about this. So it's financial toxicity of cancer care in Armenia. We know that over 80% of payments of health payments in Armenia are made via out-of-pocket payments, and this is a ridiculously high number. Because when we compare with Europe, there is no country that has more than 30% of out-of-pocket payments, and we are going to explore how cancer care affects financially cancer patients. Also, we aim to conduct a study exploring the access to cancer medicines in bordering conflict-affected regions of Armenia. We plan to have a youth ambassador project that will unify professionals, medical students, young researchers from conflict-affected regions that are willing to raise awareness about this important issue and that are willing to share the facts and conduct studies regarding this topic in their countries. This will give them opportunity to have a networking, to have a wider impact in their communities. And in the end, I would like to say our motto: every cancer patient should receive appropriate care regardless of any crisis. Thank you.
Thank you very much, Yeva. Any questions? Sure. Please.
Can everyone hear me?
Yeah.
So you have been working on this since 2021. I know it's a short period of time, but what are your findings so far? I know there's nothing good probably about it, given your topic of research, but I'd be interested to see if you've made any specific observation. And second question is, what are the anticipated outcomes of your research?
So first of all, as I mentioned, based on our literature review from other conflict-affected and crisis-affected countries, and also we had similar findings in Armenia, is that cancer care is somehow interrupted, the provision of cancer care is interrupted in times of crisis because of several reasons. If it's COVID-19, it's because of lockdown or because of lack of medical staff. If it's a war, it's again because of the emotional situation, the lack of medical personnel. And as I said before, there is a lack of protocols, there is a lack of guidelines of how to handle this problem because cancer is such a time-sensitive disease, and even a couple of months of delays in diagnosis can profoundly affect the outcome of cancer. While doctors mastered how to treat emergency conditions in times of war or in times of COVID, let's say pandemic or natural disasters, they still psychosocial emotional burden of cancer. So our findings are corresponding to the ones that were made internationally, and we are trying like our
I mean, coming up with ideas. Like one of our board members and with also very good friend Stella from UK, she made a suggestion, for example, to go on this polypharmacy issue, which is a problem about studying comorbidities and like cancer patients. They don't have, I mean, many of them, they don't have only cancer. It's gonna start in September, Yeva mentioned it. So it's kind of going, we'll see. We are just in the developing phase, but